This is IACI TV. I'm Roy Shepherd, and I've been joined by Tomas Chivato, and we're going to be talking about omics. And omics is something I've heard mentioned a lot, but I have to be honest with you, I don't understand a great deal about it. How widespread is the understanding of omics here at the Congress?
Omics are well-known techniques for research, but it's
only within research.
Research.
Okay.
But in the future will be useful in order to improve diagnosis and treatment of allergic disease. Omics are many techniques. For instance, genomics, transcriptomics, proteomics, and metabolomics. And each one study different components, for instance, genes, proteins, or metabolites.
So I guess that when it comes to paying for it, that's economics. Okay, how will omics actually help in terms of precision medicine, for example?
Precision medicine is coming, is here. With precision medicine, we can obtain the right treatment to the right patient in the right moment. So with precision medicine, we will have predictive medicine, preventive medicine, participative medicine, and personalized, very important in allergy, in the field of allergy, the personalized treatment is essential.
So where does omics fit within that, and how does it help make precision medicine more effective and more pervasive?
As you know, we have new treatments, for instance, monoclonal antibodies, and we can select the best monoclonal antibody for each patient depending on the different results when we study the patient, some metabolites with metabolomics, or some proteins with proteomics, or even some results obtained by genomics or transcriptomics. So we can obtain a better diagnosis. For instance, we will improve the treatment for that patient.
So do omics apply across the board for allergy, asthma, and precision medicine equally?
Yes, and also, for instance, in oncology, not just for allergy. It's useful for all the field of medicine. It's, as I said before, in this moment, more for research. For in the next future is coming in order to apply in the daily practice routine.
So in terms of research for diagnosis or treatment, or diagnosis and treatment?
Not for everybody, because it's not very cheap techniques.
So economics again?
Yeah, economics again, the sustainability of the system. So we must to learn to use these techniques. We must when to use in which patients in order to decide the treatment.
Why is it important for more people to understand what omics are? Not only within the fields of medicine, but also at government level, international level.
As you know, the cost of the treatments of allergic disease is very high and even affects the quality of life of allergic patients. So if we are able to improve the quality of life, finally we will save money. So we must convince to the authorities about the useful of these treatments.
So what is IACI doing to help educate, the EU and at a senior government level that this is going to be improving the quality of life and ultimately reducing the cost of healthcare or reducing the cost of illness within society?
The first step is to increase the level of knowledge about these omics techniques among all the allergy family in this Congress, for instance, because not everybody knows these techniques, how to use the useful of these techniques, and also the balance, the result of these techniques. So we will launch very soon a massive open online course, the first massive open online course on omics for all the community. IACI is really involved in this project.
So is this regarded really, and the phrase has been used, the silver bullet? Is this the thing that's really going to transform diagnosis and treatment in the future?
Yes. As you know, we have a different level of severity of the disease.
Yeah.
It's not for mild allergic disease, but for moderate and severe disease, in order to find the exact treatment for the exact patient, Omics will help us.
You can't predict the future, I know, and there was a time not too long ago when people would talk about 5 or 10 years' time. Now I'm hearing people talk, well, you know, in the next 12 or 18 months, certain things will change. How long do you think it will be before the subject of omics and the application of omics will be much more widespread than just being confined to researchers?
Very soon. In my opinion, in 1 or 2 years, probably we will use as a routine technique this kind of omics in the practice daily life.
Okay, so how much attention should people in all of the different disciplines here at the Congress be paying to learning more about omics now? And why is it relevant to them now?
It's very relevant because research is essential, it's crucial, the research. And with this omics, we can solve some problems that we don't have the answer now. If we have the answer, we can improve again the diagnosis, the treatment, and the quality of life of our allergic patients.
It's all really exciting stuff.
Yeah, it really is. It's very new, very excited, and with passion, we solve this problem.
Thomas, thank you very much indeed for explaining omics today.
Thank
That's
you.
all from Miyaki TV for now.